Well, I'm Dr. Scott Parker. I've been a practicing dental clinician for many years. I teach dentistry. I've been dealing with clenching and grinding for decades. And so, our goal today is to talk about many of the different biofeedback systems that are supposed to help with clenching and grinding today and kind of sort through what those might look like. So Lauren has pulled up a couple of different options today. The first one that we're looking at is Clench Alert. Clench Alert is unique in that it gives a haptic or a bio vibration in response to clenching. One thing I noticed when I went to their site, so this little device that we see on the screen that she's holding, what you don't see in every single one of their pictures, what you don't see is there's a tab that sticks out the other side that fits in between the teeth. This is a unilateral device, meaning we would put it on one side, the right or the left. I suppose you could buy two, but then you have two devices in your mouth. And it fits in between the teeth, and that little pod that she's holding fits against the cheek. So this is not a custom fit. This is just a piece of plastic and material that you put in between your teeth. And as you clench down, in response to the pressure, it will vibrate. My concern with this is having a unilateral piece of plastic or something in between your teeth can cause your jaw to shift or tip to one side. So you'll either put more pressure on the side that the device is on, or you will, in essence, dislocate or create a gap in between the joint and the socket on the opposite side. The other concern that I noticed on this device is small enough that we could, if we're not conscious of it, we could actually swallow this device. So that would be a little bit of a concern for me. I don't know if it's happened, but in looking at it, we could technically swallow something of that size. So I'm a little nervous about this being a choking hazard as it moves around the house or the mouth if we get too relaxed. And the other thing that I noticed with this device is it doesn't actually provide me as a clinician any data. So it's not collecting data. It's not collecting sleep data. It's not collecting clenching or pressures or sounds or anything like that. It's just responding to the clenching in the device itself with a small vibration that would alert you. So it's an option. There are some risks associated with it, but it's a curious one. And I noticed in all of the pictures, they don't ever show that bite tab. I think there was one I was able to find where they were doing a comparison of this device. So that's the Clench Alert device. So the next option for some type of biofeedback for clenching and grinding is actually called Easy Bite. I'm assuming it's pronounced easy, AESY Bite. And this is made by a company out of Europe. I believe, are they a Swedish company? And this is actually more similar to the Zarine product. So this is actually a bite that's made. You can put this in, it molds to your own bite. And there are sensors embedded throughout the tray that do provide biofeedback. So this will actually give you data. So this, in my opinion, is better than the previous Clench Alert option. And so it does provide that data. I don't know what their haptics are for biofeedback, but I do know that they're collecting data and they do have some other products. However, this product, from everything I can tell at this point, is not currently commercially available. And I tried to find a way to order one as an example for myself, and I couldn't. There was no option for me to buy this, to utilize it, to even try it out. So to my knowledge, this isn't commercially available at this point. So while it does look like a reasonable alternative, it is not currently available. And I think one of the reasons is this example on the page that you're looking at right now. It says oral appliance technology for sleep bruxism, which would be fine, but then it goes on to say, and obstructive sleep apnea. In order to be approved for obstructive sleep apnea, you have to go through a lengthy process with the FDA. And I'm nearly certain at this point that they would not have market clearance for claiming obstructive sleep apnea as an option for their device. So, for that reason, I suspect that's why this is not available, because to actually be able to claim that you're helping with obstructive sleep apnea, you have to go through all kinds of levels of FDA and regulatory stuff to be able to say obstructive sleep apnea. However, it does look like a reasonable device. It's not something you could swallow. It does provide data, and it looks like a reasonable option. So these types of appliances, like the one on the screen right now, made by EasyBite, these are what we call boil and bite, meaning you warm these up and then you bite into them and they form themselves to your teeth. So we've been using these for decades for sports mouth guards. You can buy these inexpensively at any sporting goods store. However, they are not what we consider a true custom fit mouth guard, and they're typically much bulkier than a true custom fit. So for me as a dentist, one of my concerns is if these are bulky, people tend not to wear them. Because a lot of times, if you're trying to sleep, you can't get your lips together because this is really thick in the front. And so these aren't what we would consider a custom mouth guard or a custom appliance. So a little bit different, fairly bulky. And the opposing side is just a flat plane where those sensors are located. So then you have the opposing arch, which in this case would probably be the lower teeth, biting into those sensors, which can or cannot be beneficial. But again, bulky, much bulkier. So our third option for a biofeedback device for clenching and grinding is Zerine. Zerine is fairly unique in this space. This has been, the research behind it has been going on for years. This is actually a true custom fit mouth guard. These are made by a dental lab. They fit beautifully over the teeth. They're very thin, and so they're not obstructive. They don't push out the lips. They're very comfortable to wear. And there's a little device that plugs into that mouth guard that then collects all the data. And it's very unique in that it collects pressure data, it collects clenching, it collects sound, it collects all kinds of positioning, which is really important for me if I'm dealing with a patient in sleep, because I can actually tell from the data whether they sleep better on their right side or their left side or their back with this type of a device. It's a positional sensor as well. So when we have this kind of data, really, really important. Now, as a dentist, it's also really important for me to see their clenching data. I can see how much they clench. I can see what kind of clenching, whether it was super high pressures or just light pressures, and how long that duration lasted. So this is a custom mouth guard. We can't swallow this. I've actually worn this in my own mouth, and there's a little tube that connects the pod to the night guard or the mouth guard. And at first, I thought this was going to be kind of bulky and hard to wear because it's big, but I found I didn't even notice it when I slept at night. It was very comfortable, true to the claim of being thin and comfortable, so much so that I didn't even notice it was in, which was a big concern for me as a dentist. So they've done a nice job on making this comfortable to wear. Again, it collects all kinds of data, and then it will begin after it's collected and done a position kind of a analysis of your clenching. Then it will begin to provide feedback. So first there's learning, and then there's training. The device learns your patterns and then begins to train you and to open your bite to release that pressure just through light vibrations. Passive vibrations that aren't obnoxious, they kind of tell your body to stop doing what it's doing. So it's kind of a learning module, and it's very, very cool to see it. And as a dentist, for me, this is actually a much better solution than just putting a piece of plastic or an orthotic in between the teeth, because not only are we protecting the teeth, but now we're actually training the body to not do the habit. So this whole biofeedback thing, super important to retrain these habits that we've learned over all those years. So for me, this is a much better option than the other two. Um, from the perspective of learning and then training, I think this is a great option. One of the other things about doing this biofeedback for me that's really important is the long-term consequence of clenching. So when we're clenching our teeth, we're actually damaging our jaw joint. All those years of squeezing down and putting pressure on this joint will eventually lead to joint damage. We hear this initially as popping sounds in our joint. Eventually, it'll lead to pain. Sometimes it'll even lock us open or locked closed with muscular challenges. So the feedback, the sooner we can get these types of feedback devices in place and start retraining those habits, the better it will be for long-term health of the joint. Jaw joint surgeries are, gosh, last possible option. I have a lot of patients that have gone through jaw surgeries, and it is just an extremely difficult surgery to heal from. Unlike our knees, where we can stay off our knees while we're healing, or our hips or our shoulders, we can't really do that with our jaw joint. We have to wire the jaw shut, and even then, we can still clench down. So jaw, protecting our jaw is so important. And I would encourage anybody that's on the fence about whether or not to do something for these jaw conditions, I would strongly encourage you to be proactive in this one. It's a hard one to recover from.